So, and she said that all she's done is her skincare olive oil thing, right? That's it. Hi, I'm Dr. Gary Motykie, and I'm a Beverly Hills board certified plastic surgeon. And today I wanted to go through J.Lo. Lover or hater, there's definitely some controversy out there, a lot of talk about what she's saying she has or hasn't done as far as plastic surgery. And I think there's some good information, education, and some things we can go through today to help people realize what is achievable without surgery and what surgery can do. So I think in her case, I've heard some stories that she's saying all she's done is her olive oil skincare line, and that's why she looks amazing and nothing else was ever done. Just in general, I think people should realize that even though some people say beauty is skin deep, aging is not. In other words, as we age, a lot of things change about our face. Its structure, its volume, not just the skin, everything's changing. So whether you're lathering gold dust or fairy dust or diamonds on your face and skincare products that are the best in the world, you're still gonna have issues with aging. Aging and gravity always win. So as people get into their late 40s, early 50s, things start to change, things start to sag, things start to have the appearance of aging, and that's normal. Skincare in general will address the skin problems. It'll help with volumizing, hydrating the skin, reversing some of the sun damage, protecting the skin, maybe even nutrition, different things for the skin that may help it age slower. But as far as all those other things underlying the aging process, it's not going to address any of those. So if we look at J.Lo, I think in general, she's obviously attractive. She has great facial features. She's maintained her beauty through the years, and I think that's a positive. But to say it's just related to skincare and there wasn't a facelift or other surgery, I'm not so sure. And when I'm looking at her right away, one of the first things that always stands out to me is the nose, and her nose has definitely changed over the years. Whether she wants to admit it or say that she's had a rhinoplasty, it certainly appears that way. The nose, again, over the years has changed slightly, gotten more refined, smaller, and all those aren't changes that happen with the normal aging process. So most likely some sort of surgical intervention like a rhinoplasty was done, or multiple rhinoplasties, kind of little tweaks along the way, or what we call finesse rhinoplasties. If we look at her nose throughout the years, again, we're going to see subtle changes that I see changes in the bridge, I see changes in the tip, even near the nostrils, and all of those things aren't going to just occur naturally as far as becoming more refined, more defined, smaller. All of those things happen with surgery. One of the, I think, most notable photos of her is a photo that was taken several years ago where she appears much older than she does in current day. And again, whether you're putting skincare on or not, it may help with the skin, but some of the things that you're seeing in this photo aren't going to be changed by skincare. So she's starting to show the normal, just a normal process as women and men get into their 40s and 50s. We start to see a little jowling, the face descending, mid-face volume coming down, even seeing bags under the eyes or a little bit of shadowing under the eyes. Those are all normal things. And what happens is people appear to look a little more tired, again, older, grumpy. Those sorts of things are all expressional things that happen with the normal aging process. To reverse those, putting skincare is not going to happen. You got to re-lift, tighten, move things back to where they used to be and add things back to the face in order for it to appear natural or the way that you did when you were younger. So if we look at a face as it ages, the things that are characteristic are that this jowling area will start to come down, like I said, and you'll see frown lines in the face descending. And then secondly, also you'll see changes in the brow coming down, that frowny kind of grumpy look. Even though people aren't grumpy, it just appears that way. And then also the nose changes. Like I said, the nose, the tip will lose some of its elasticity. It'll start to drop a little bit, get a little wider, get bigger. And these are normal things that happen with aging. When we don't see those things happening or things going the other direction, some sort of surgical intervention was probably done. And one thing I want to tell people, what I said in the beginning was that aging isn't skin deep. And what I mean by that is as we're aging, it's not only the skin that's aging, the facial fat in your face starts to atrophy or shrink. So you're losing that volume. That's why people do fillers to add that volume back to the face. Secondly, even deeper, the muscles in the face start to atrophy. The bones start to atrophy. The whole face starts to shrink. And that's why we start to see things falling, descending as well as the skin losing elasticity. Now, skincare products in general may promise to increase elasticity and do a lot of things as far as rejuvenating the skin. It will help with some things, but it's not going to tighten skin up and lift it up and put everything up where it's supposed to be, add volume back, and that's what a good facelift does. So a facelift's going to address all of these problems. It's not simply tightening skin. That's one part of it. The second part of it is tightening the deep layers and the muscles, adding volume back to the face that's gone away. All of those things is when you look at somebody then when they're in their 40s, 50s, 60s, you're like, wow, they're not aging, they look amazing. Most likely a combination of these things have been done and not just skincare. And if you look again at a normal photo of a person in their 20s, 30s to their 50s, 60s, you're going to see all those changes in what somebody in their 50s would naturally appear like. So you can see the changes in the face, the hollowing of the eyes, the jowls forming, all those things, the lip shrinking, the nose changing. And when those things are being reversed, we know that there's surgery involved. One of the things I wonder about is why somebody in this day and age is ashamed of saying they had surgery or not having surgery, because I think the social stigma of having plastic surgery has really decreased. I think that it's much more acceptable. I think that people are aware that it's out there. It's everywhere. It's on social media. It's in movies. It's on the internet. So people know that this is happening, and I'm not sure unless there's a financial motivation or other things that you don't want people to know that you had surgery, because it should be acceptable. It's not something you should be ashamed of. My patients are almost proud of it now, like to talk about the surgeries they're having done. The process itself is a positive experience, and it's not something that needs to be done behind closed doors and back offices anymore. This is something that's very acceptable, and I think also it would be actually a good thing if celebrities or people in the limelight or in the media were to talk about their experiences and surgery and what they're having done and how to do it right and what to look for. I think that would actually help a lot of patients, instead of saying that it's all natural and there's nothing to see here and it's just from skincare. So I'm not saying she had a facelift and surgery, but it certainly appears that way. But overall, I will say what she has done is done very well. I think the overall result is great. She looks very natural. She looks like her younger self, even maybe a little prettier. This is a good move as far as if it is surgery. I think the results of it are very natural, and I think it's done very well.